Even before the kind of formal shelter in place was in effect, a lot of my clients who are mostly in professional settings, their workplaces were already starting to ask people to work remotely. And so it kind of started to happen a little bit naturally and a little organically, where some of my clients were also removing themselves from either the city or just being at home. And so they weren't coming to my office anyway. I just started to offer the telehealth, like a remote tool in order to connect. It just kind of started to transition a little bit organically.
So tell me, what are some of those teletherapy options that patients have right now?
Telehealth is kind of an umbrella for whether it's going to be kind of web-based, either through chat, or it could be telephone even, or video, similar to what we're doing. And so for me personally, I'm using video capabilities. And so there's a lot of different platforms. Although there are like kind of a subsection of tools that are specifically recommended because they're more secure in terms of security, confidentiality, those kinds of things, and also like connection and things like that. And so that's kind of what I'm using, certain tools that are kind of more geared towards actual medicine and mental health providers.
And do you see that people are actually liking it and feeling the same effects with the teletherapy sessions versus meeting face to face?
I'm finding that at least for my clientele, so they tend to be in the age range between like 20 to early 40s. I think there is a comfort level with technology and the use of things like, using their phone or using their computer in order to connect with people remotely. And so I'm finding that their transition has been pretty seamless. And I think as long as there's a consistency in care, even if it's going to be in person or online, I think that seems to be the priority.
Could you see these remote sessions being maybe the preferred method in the future, once the pandemic ends?
That's a really good question, because I do find that some people already have kind of a leaning towards in-person therapy, because a lot, especially if the relationship was already built in person, there is kind of a bias towards establishing and continuing and maintaining that connection. But I know that some people, they prioritize kind of that accessibility and the convenience factor too. I think it's going to be, now that people have had a taste of what it's like to just do, mental health services and like therapy remotely, I'll be curious actually in terms of what happens, both from the practitioner end. If there's a preference almost for certain practitioners to kind of continue with remote, as well as on the consumer end too, if they find, hey, actually, this was something that I really preferred and I found it just be equally helpful.
What are your top 3 tips for people during this time to stay mentally healthy?
I would say number one is really to stay connected to people. So even though there's all this kind of the public health recommendations to distance yourself, it doesn't mean you need to completely shut yourself off from people. So find those creative ways to virtually connect to people, call people, just because that's so essential to our mental health. And then the other thing is to continue trying to keep up with those activities that you really do enjoy, obviously within reason. There's certain things that are hard to do right now, but whatever you can find, and even if it's just starting new activities, start doing that. And then to be kind of mindful of how much you're engaging with information that's out there, just because that can sometimes be, empowering and informative, but sometimes it can be even more stress inducing. So just being mindful of that.